Now, President Cyril Ramaphosa will this afternoon participate in a joint media briefing on COVID-19 vaccines. His French counterpart, Emmanuel Macron, and World Health Organization Director General, Dr. Tedros Ghebreyesus, will also be in attendance. Now, this comes as France is on a drive to inoculate its citizens above the age of 55 in South Africa. For more on this, as well as an update on France's commitment to vaccines for the African continent, I'm joined by French Ambassador to South Africa, Monsieur Aurélien Le Chevalier. A very good afternoon to you, Monsieur Le Chevalier, and thank you for your time today. Perhaps let's start at the beginning, the reasons why France found it necessary to inoculate its citizens in South Africa, at least those who are 55 and older.
Well, I think it's part of the moral obligation of a country, to take also the citizens abroad into consideration. It's the same with South African people in France. They are vaccinated in France, and so we have a very small number of doses, actually only 2,000 doses, to vaccinate the French community here, only for the people more than 55 years old, sorry. So that's why we decided to put this program in place.
So there are 2,000 doses, and you have chosen to use Johnson & Johnson as your vaccination of choice there. When are these doses arriving? Have they already arrived? When is the process beginning?
Yes, they arrived actually with the presidential plane when President Macron was paying a visit to President Ramaphosa at the end of May. So he brought with him these 2,000 doses. We chose the Johnson & Johnson Janssen vaccines, which are produced in Belgium, in the European Union. These ones are the same doses that were inoculated also in South Africa in February, if you remember. So we used the same patents, the same system. And, the time to organize the vaccination, it started this week, actually, in Gauteng and in Cape Town tomorrow.
I'm quite interested in this. You mentioned that South African citizens who are in France have also been vaccinated. Who arranged that vaccination? Was it arranged by the South African government, or was it part of the French government's vaccination drive?
That was part of the French program, but it was in partnership, of course, with the South African embassy in Paris. So we shared information. We made sure that the South African people, the South African residents, the people working and living in France will be covered. And that's how we decided to organize this together.
There must be some French citizens who are watching this who are under 55 years of age and are asking, will they also get an opportunity to be inoculated by the French government?
Yeah, it's a good question. And actually, I made a mistake because in Cape Town it started last Saturday. But we thought that the elderly and also the most vulnerable people with comorbidities should be in our priority list. So that's why we decided to go first with this part of our residence here in South Africa. But we hope now that, of course, the rollout of the vaccination campaign in South Africa will accelerate. We hear good news that this week South Africa will receive new doses from Johnson & Johnson and for Pfizer as well. So we hope that the French citizens living in South Africa will be able also to get vaccinated through that same national program.
Let's cast our net a bit wider outside of South Africa and focus now on the rest of the African continent. There's a big announcement that is being expected to be made this afternoon by French President Emmanuel Macron, South African President Cyril Ramaphosa, as well as the WHO Director General Tedros Ghebreyesus. What is this big announcement?
It's very important indeed and quite historical, because today everybody is rightly focusing on the access to the COVID vaccines, but it's also very important to prepare the next steps. And the next steps is to make sure that in Africa the African countries and the African economies are able to manufacture their own vaccines. That's why when President Macron came in South Africa last May, they announced with President Ramaphosa a new initiative supported by the international community and the World Health Organization to make sure that the African capacities of manufacturing vaccines will receive expertise, funding, and tech transfers from pharmaceutical companies. So that's why this is what the two presidents will announce this afternoon with the DG of the WHO, the World Health Organization. So it's a very important step forward.
The issue of intellectual property regarding how these vaccines are manufactured has been an area of discussion for quite a long time now. What does this new development say about this IP? Where are we regarding that?
Well, it will create a platform where the pharmaceutical company can voluntarily transfer their licenses and their know-how to the World Health Organization. And then companies, for example, in South Africa, will be able to use this know-how, to use this knowledge, and to use temporarily these licenses to prepare the manufacturing of the vaccine. So it's really a new model that will be announced this afternoon under the aegis of the United Nations, and thanks to the joint leadership of South Africa and France. We've been working on that program for many months with other partners, including Germany, including the World Bank Group. The US is also involved. So it's a multi-shareholders, if you want, partnership. But this announcement will be really a key moment for these African capabilities.
So what does this mean logistically, Monsieur Le Chevalier? It is the first messenger RNA technology hub, transfer hub. It will be located in South Africa, but for the benefit of the entire African continent. Will there be sub-nodes or sub-hubs, perhaps, that are created in other parts of the continent, or will this be its main domain in South Africa?
Well, we will have to wait for the announcement to get all the details. I don't have all the information, but I understand that is exactly what you are saying. It's a hub, and the idea is to develop different regional hubs. So South Africa will be one of them, certainly covering Southern Africa, but most likely also a very significant part of the African continent, and that will start very concretely, operationally, with the transfer of expertise, transfer of fundings, and of technology to make sure that these capability programs are really making progress in the weeks and the months to come.
France has made an additional pledge of 30 million vaccine doses to COVAX. Has that already been delivered? When will it be delivered? We are finding as the African continent that there are a lot of pledges that are being made, but the delivery and acting upon those pledges seems to be quite tardy.
Yes, it has started through this collective platform called COVAX, also led by the WHO. So these doses have been delivered to other countries in Africa. For example, last week it was for Lesotho. Next week it will be in Mozambique. Other countries already received these doses. And we understand that South Africa will be also part of the beneficiary countries. South Africa is in, let's say, a different category because is a beneficial of this program, but is also a middle-income country with a strong economy. So that's why it was not part of the first countries, the least developed countries, of course, to receive these vaccines. But we really hope it will accelerate. And actually, you are right to say it used to be 30 million doses, but President Macron decided to increase to 60 million doses when he participated to the G7 summit 10 days ago. So it will be even a larger contribution by France. And we also announced that we will provide 500 million euros in contribution for these ACTA and COVAX mechanisms in Geneva to accelerate the process. So if you add all these different initiatives, I really think that we will make good progress and build on what has already been done in the last months.
You touched on the 500 million euros in multilateral funds. Are these going to be loans, or is this a grant that's been given?
No, these are grants. When we will work with the private sector, it will be loans. But for ACTA, it's really grants. So this is of course very valuable, serious money from our development funds.
And just out of interest, before I let you go, which vaccines are being used in France for your rollout program?
We have a diversity of vaccines. We are using also the Johnson & Johnson, but also Pfizer, Moderna. So actually, I think the strategy of the government is to diversify the supply chain and to try to use all the different vaccines. So it's quite open, if I may say, at the moment. The vaccination campaign was quite slow at the beginning, but we accelerated recently, and we will try to reach, like South Africa, our objectives until the end of the year.
There has been a bit of talk and questions around Sputnik 5, the Russian vaccine, as well as the Chinese one. Where does the French government and the French health authorities stand regarding those two specifically?
Well, we follow the guidance of the European agency, and I think the Sputnik V or Sputnik 5 is not authorized on the European Union delivery programs at the moment. So they are still discussing with the Russian authorities. And for China, I'm not sure. I will have to double check for you. But I don't think the Sinovac or the Sinopharm are also allocated in the European Union at the moment.
Monsieur Le Chevalier, thank you very much for your time this afternoon. We certainly do await that big announcement that's coming up a little bit later on with the two presidents as well as the DG of the World Health Organization. That is the French ambassador to South Africa, Monsieur Aurélien Le Chevalier.